Okay, my presentation about chronic cerebral vascular insufficiency. Second, first page. Say. Okay, the cerebral vascular disease is one of the most common cases of the disability and mortality among the population. The disease are divided into acute cerebral vascular disorder and chronic brain vascular disease, which in the co- country, which in the country are more widely known as the discirculatory uh, encephalopathy. This term is used to indicate cerebrovascular pathology that develops in the event of the mobile posal and or device brain lesions or the progression of the neurological and physiogenic disorders may be connected by
Ali, we can't hear you. Ali.
hello
We can't hear
second
you.
second
Right.
page. Okay, etiology. The term cerebrovascular insufficiency describes reversible attacks of the focal cerebral ascomala affecting the patients with extensive extracerebral artery disease. The The attacks are caused by the fall of the culpable blood supply and are often related of minor reductants in blood procedure. Characterize clinical features such as directing involuntary movement and loss of the phage on in the reborns. 2. Bright light may allow influency attacks be distinguished from other versions of the fossil cerebral asthma. The treatment of the patient with cerebral insufficiency aims to insert collateral blood supply by surgical removal of the arterial abs and by middle therapy to the prevent episodes of the systemic hypertension. Same change. Okay, pathogenesis. cerebral vascular disease pathogenesis processes entrance to the blood. These blood vessels are the contents through which oxygen and nutrients reach all tissue of the body. Distortion of the flow of the blood by intrinsic processes theory cases discerning of the flow of the oxygen and nit- uh, nutrients to the uh, research tissue. This results in the hypoxia and if prolonged asthma, death of the affected tissue in the brain. There are several intrinsic processes that can cause hypoxic disease much in the same manner by which the major cerebral arteries are organized segmentally to the facultative organization of their function. These interesting processes are divided into broad categories. This category arterial stenosis and damage to the arterial wall. Second page. This clinical picture about the disease. Change the picture. Treatment. This fixed combination containing 5 mg of the vimpoctane and 400 mg of the barbitumine was presented to the 340 patient with uh, discirculatory encephalopathy. Stay does one cases their time 3 times in the day. Drugs 3 months after this treatment repeated neurophysiological testing showed significant dim- dimension of dissociative cognitive impairment linked with the frontal lobes dysfunction. The substantive improvement was associated with the regression of the subjective neurological symptoms like headache, dizziness, tinnitus, and fatigue and insomnia. Ventilator was saved and will tolerate in the elderly patient with chronic cerebral vascular insufficiency. Change the page. Thank you for your attention.